According to the World Health Organization, headache disorders affect 40% of the population. Stay tuned because today you will learn what headache types respond better to supplements and which supplements are evidence based. Hi there, I'm Dr. Krista Burns, founder of the American Posture Institute, and your host on the Virtual Neurology Summit. The purpose of the Virtual Neurology Summit is to provide healthcare professionals with brain based solutions so you can get better neuroplastic results with your patients. I'm honored to welcome our next guest expert. Dr. Amelia Scott Barrett, MD, is a Stanford trained neurologist. She's the founder of the Migraine Relief Code, where she offers online courses showing people how to find and fix the hidden causes of headaches using new tools like genetic testing and smart health devices. She's a TEDx speaker, and her work has been featured in Business Insider and Women's World. Today, she'll be sharing with us new supplement protocols for people with headaches. Dr. Barrett, thank you so much for joining us again this year on the Virtual Neurology Summit. Please take it away.
All right, let's talk about new supplement protocols for people with headaches. And I think everybody was a little bit bored during COVID. So many people went back and did these fantastic systematic reviews and meta-analyses of all of the data that we've accumulated over the past 30 years with regards to supplements and headaches. So I am excited to share with you this new information. We are going to build a supplement stack for your migraine patients during this presentation. All right, magnesium, still the one. If you are only going to prescribe one thing to your migraine patients, this is what you should be using. There's no doubt about it. There was a 2018 systematic review of 204 studies that showed a reduction in migraine frequency with magnesium. And just as a refresher, magnesium works by blocking glutamate, also substance P. You can remember that with P for pain. And it stabilizes blood vessels as well. Migraine is a vascular condition as well as a chemical condition. So it's helpful to have agents that target both limbs of that pathway. Now, I have used MAG in plenty of people with tension headaches as well, still get great results. So I think that no matter what the headache diagnosis is, this is your number one go-to supplement. And just in case you have a hard time remembering what glutamate does, here it is. Glutamate is the main excitatory neurotransmitter in your brain. So magnesium is working by shutting down that overfiring. In a very broad sense, you can think of headaches as overfiring of the brain, and that's where magnesium is working. So let's talk a little bit about best practices for magnesium. You can use it as a preventive or as an acute agent, which I think a lot of us forget. So as a preventive, I recommend magnesium in the glycinate form. You want something that's highly absorbed, 400 to 500 milligrams a day, usually at night. Now, once the magnesium is inside the body, your body can convert it into whatever form they need, and they all cross the blood-brain barrier. You don't have to worry about that. The rate-limiting step in magnesium absorption is through the gut. So that's where you need to focus. And the chelated forms, that are bound to an amino acid like magnesium glycinate, those are going to be the best absorbed. Now, for acute treatment, people have used doses of 1,000 milligrams for acute treatment. And there I like a liquid or a powdered formulation so that it hits the bloodstream super fast, kind of like an IV. If you do IVs in your office, you can offer IV magnesium as well. And you want a little bit of fluid, salt, and sugar with that. Now, I also recommend adding a fish oil tablet to that acute treatment protocol. And here's why. There was a very interesting 2018 systematic review of 13 different trials that showed a reduction in the duration of headaches with fish oil, but not the frequency. So that makes me wonder, is that because it's basically an anti-inflammatory medication? It's sort of it's an alternative to an Advil, except it's not going to cause rebound. So that could be part of what's going on there and why fish oil helps to shorten the duration of a headache. And don't forget about actual fish. This was an incredible study that came out in 2021. This study actually made the Andrew Huberman podcast. So that's how far the reach of this study has been. I've done several podcasts about it for the National Headache Foundation. And so what they did is they had people eat 4 to 8 ounces of fish. They used salmon in this study every day. I don't know how they got people to do that, but they did. I have a hard enough time getting people to eat it once a week. But anyway, they did. They got people to eat it. And at the same time, they took out their seed oils, their highly inflammatory omega-6 seed oils, canola, vegetable, etc. Replaced that with a combination of olive oil and macadamia nut oil to increase the smoke point of the olive oil, right? Because you can't fry with that stuff. But if you add macadamia nut oil to it, you can. So super clever solution. They told people use this oil for everything, except probably not in your pancakes, but in every other place in cooking. And what they saw is that headaches dropped in half in 3 months. This is like the most powerful diet intervention study that has ever been done for headaches. So the actual numbers are that people dropped from having 16 headache days per month down to 9. That is a powerful effect. That is better than many of our prescription medications. All right, so here's our supplement stack so far. We've got our magnesium, we've got fish oil, and we've got actual fish. All right, so here's where we're at. Let's keep going. All right, what about mitochondrial helpers? Now, I personally am of the opinion that this is the future of headache medicine because of the unbelievable fact that even if you're running a marathon, your brain is using more energy than your muscles. That's how greedy this little organ is. It's like it's got very high energy demands. So just a quick little science review here, if you remember. Our food gets broken down, comes in through the citric acid cycle in the bottom left. That basically spits out stuff that can go through the electron transport chain in the inner membrane of the mitochondria. I'd like to point out that FAD2 and FAD, that's made from vitamin B2, riboflavin. And that Q there, that's CoQ10, coenzyme Q10. It's basically an electron shuttle throughout the electron transport chain. And the purpose of all of this is to make ATP. Ka-ching, that is the currency of your nervous system. So you have probably heard that the American Academy of Neurology actually recommends riboflavin and CoQ10 for people with headaches. So here's my issue with this though. Riboflavin is definitely in the stack because it is a good mitochondrial helper, but what dose? So there was a randomized controlled trial in 1998 that basically set the dose for all of the subsequent studies. Nobody has ever done a dose ranging study. We use 400 milligrams a day, which is, astronomically higher than the US RDA. Not necessarily that those are set in stone either. That's not what I'm saying. But I'm just saying we don't actually know how much B2 you need to have that effect. Like I say, we use 400 a day. And there was a 2022 meta-analysis of 9 studies that showed reductions in migraine frequency and severity. So it's good as a preventive and an acute, definitely a good drug. Our next mitochondrial helper is CoQ10, also definitely in the stack, but again, I don't think we know the best dose. So a 2021 meta-analysis of 6 studies showed reductions in migraine duration and frequency. So this one also functioning kind of as a preventive and as an acute. The dose that was used in all of those studies is 100 milligrams 3 times a day. No reason to think you can't bundle that all up into one single dose. Like I say, we don't really know. All right, so our stack is growing. We've got the B2 and the CoQ10 on top of the mag and the fish oil. Now, let's not forget about sleep, because nobody's headaches are going to go away if they're not sleeping, right? I mean, it's not going to happen. So there was this fascinating study that was published in 2016. This came out when I was still prescribing amitriptyline in my practice, and it definitely changed what I did. So this is a randomized clinical trial comparing melatonin 3 milligrams to amitriptyline 25 milligrams, and then both of those to placebo for migraine intervention. And what they found is that melatonin actually worked as well as amitriptyline. Obviously, way fewer side effects, no constipation, no weight gain, zero effect on mood, except possibly in a positive direction via sleeping better. So melatonin is much better tolerated, but there was a statistically significant benefit for melatonin compared to placebo. And so is this strictly due to the effect on sleep? Getting better sleep means fewer headaches. Is it an effect of melatonin directly on headache reduction? We still don't know. But what we do know is melatonin is part of the stack. All right, and we can't forget vitamin D, right? We all know how important vitamin D is for the brain. Vitamin D deficiency is a known cause of dementia, so it's absolutely essential for proper functioning of the brain, and brains that aren't healthy have more headaches and migraines. So we're actually not quite sure how it helps migraine. A lot of theories out there. We're not totally clear which one is the most important, other than, yeah, it helps the brain kind of a thing is where we're at with that science. Most of the studies have used a dose of 2,000 IUs per day. But again, are we sure about that dose? Shouldn't we just be looking at levels and supplement vitamin D up to a level of maybe 50 to 70? A lot of people will use that range for vitamin D. Whatever dose you use is fine. But I think that it probably does make more sense. So I'm not going to recommend a specific dose of vitamin D. I think you should target that based on what your patient needs. And there was, in fact, a 2021 meta-analysis of 5 studies that showed reductions in migraine frequency. So this is definitely making the brain healthier. It's making it less likely to generate headaches and migraines. All right, so at this point, if we add vitamin D onto the stack, our patients hate us. They're never going to take all this, and they probably won't come to see us again either. So one solution is to wrap up a couple of these supplements into one. So I'm going to recommend that you find a powerful multivitamin, which I've got here on the left. And what that multi needs to contain is CoQ10. And like I said, I don't necessarily think it has to be 300 milligrams of CoQ10. You're not going to find that in a multi anyway, but maybe a little is okay if what it means is that the patient is taking it. And I apply that to the same logic with the B2. We don't know the dose, maybe a little bit is okay. So you wrap both of those up into your multi, and then you also find one that has vitamin D. Now, if this is just maintenance, you're usually okay with like the 1,000 or 2,000 units that comes in a lot of the multis. If your patient has a vitamin D of 20, obviously that's not going to be enough. You're going to have to do something else. So a little bit of a caveat on, the one size fits all on the multi here. But you can use this strategy, and then here's what you've got. Your stack looks a lot more manageable. So you've got a morning dose for people, and you've got an evening dose for people. Your morning dose is that multi I was just talking about with the D, the B2, the CoQ10. Also, fish oil. Tell them they need to eat fish during the day. And by the way, if any of you have really good strategies for getting people to eat fish, please let me know. And then their PM dose is the mag-glycinate, 400 to 500 milligrams in the evening because it tends to calm people down. It's good for anxiety. And melatonin, 3 milligrams, which is a much more manageable stack. Now, I know what a lot of you are out there thinking. You're like, but what about feverfew and butterbur? Well, I have good news for you, sort of, on that. Recent studies have actually shown the benefit isn't that spectacular, so I don't think we need to put it in our stack. Our other agents are far more powerful. So let me review this with you. Feverfew, there was a review of 6 studies published in 2020, and on average, they showed a decrease of less than 1 headache attack per month. Now, that's statistically significant, but I don't think that's going to change anybody's life. Is it really worth it to add on another pill when the other pills are so much more powerful? I would say no. It does work as an anti-inflammatory, and just a heads up, it causes vasoconstriction. So we do want to think twice if we're giving this to somebody who might get pregnant, like a young woman. And those are very commonly the people who have migraines, right? There's a risk of miscarriage with it. So we kind of got a little caution on that. And then Butterbur is actually fantastically effective. Butterbur is the original CGRP. The last dozen prescription medications that have been approved are CGRP blockers. Well, Butterbur does that. That's actually the mechanism of actions. It's directly blocking the last step in the pain cascade that produces headaches. So it works. The trouble is trying to get a PA-free formulation. We know that these PAs cause liver failure, and several people have had transplant. I mean, that's bad, liver failure. And unfortunately, they've done some quality control studies looking at Butterbur supplements that are labeled PA-free, and they're not. So I just think because of those uncertainties, it's probably better to stick with stuff that is all plus, no minus, and we're already giving people so many effective things anyway that we probably don't need to bother with this, with these two supplements. So here is a list of all of those studies with the links, so you can go back and dig a little deeper, get any more information you may want to get.
Dr. Barrett, thank you so much for this excellent presentation. I know that you are a phenomenal resource and that you have helped so many patients suffering from headaches and migraines. So thank you for putting the research together and then making it so applicable for all of us to implement with our patients. I'm going to go through a quick review and then a couple of questions. So we talked about creating the perfect supplement stack for migraine patients, starting with magnesium, number one, shown to reduce the frequency of migraines, blocks glutamate substance P while stabilizing blood vessels. Glutamate, the main excitatory neurotransmitter, so shuts down overflow or overfiring of the brain. And then preventative or an acute agent. So preventative in the glycinate form, and for acute, for treatment, liquid or powdered form are the best, and combine that with fluid, salt, and sugar. And then add a fish oil tablet for reduction of duration of headaches with fish oil because it's anti-inflammatory. And then also eating fish. So dietary alteration, you showed a great paper, dietary alteration of 4 to 8 ounces of salmon daily and reduce seed oils replaced with olive oil and macadamia nut oil. Headaches drop by about half. Really phenomenal study. And then mitochondrial helpers. So the brain uses more energy than the muscles, even while running a marathon, which is a phenomenal metabolic capacity of our brain that we're utilizing that kind of energy. So looking at oxidative phosphorylation, the electron transport chain in the inner membrane of the mitochondria, and ultimately we want to help stimulate producing ATP. So looking at riboflavin and CoQ10. Riboflavin is associated with reduction of migraine frequency and intensity, and CoQ10 decreases migraine duration and frequency. And then melatonin, statistically significant, better for sleep to help reduce headaches. So also can be associated with having a better mood because getting better sleep and rest at night. And then vitamin D deficiency is a cause of dementia. So it helps have a healthier brain and then reduction in migraine frequency. And then looking at some other options and looking at the positive versus the negative effects, feverfew and butterbur, not enough benefit to be recommended with our stack. So feverfew could be associated with vasoconstriction and risk of miscarriage. And then the butterbur, it blocks the pain cascade associated with headaches, but it could be difficult to get the PA free. And that could be associated with further complications like liver failure. And so looking at the stack, ultimately it was magnesium, fish oil, fish, riboflavin, CoQ10, melatonin, vitamin D, and then being able to put those together with a powerful multivitamin that includes the CoQ10, the riboflavin, the vitamin D, so that it makes it a little bit easier for the patient so that we can get that good compliance with the treatment protocol. And you talked about doing a morning and evening dose. I absolutely love this. Thank you again for making it very practical. My question for you is, this is a great dose for patients who are suffering from headaches and migraines. Once they start to subside with headaches and migraines, do you recommend that they still keep taking the same stack as a preventative measure for headaches coming back?
I do. And the reason that I recommend people continue these supplements is that we have probably fixed a fundamental problem with the way their body works by giving them these extra nutrients. So, for example, we know that there's huge genetic variability in methylation pathways. Maybe that's how the B2 is working. It's not one of the main ones, but it's part of that. Maybe they have genetic problems with how their mitochondria produce energy. Maybe they have abnormalities, genetic abnormalities in how their body processes vitamin D, how they absorb it, how they transport it, how they use it. And so I think that what we have done is fix a problem we didn't know about genetically. And of course, our capacity to diagnose these problems with genetic testing has just skyrocketed. It's fascinating. I love all the information we can get about our bodies and our patients' bodies these days. It's amazing. But without having to go to that extra expense or, level of detail for the patient, I think that what has happened is we fixed a problem we did not know about. And when so many of these people with migraines, they don't have one problem. If they did, they would Google it, figure it out, and fix it. And they don't. Migraine is still the number one cause of disability in women under 50. It is a gigantic problem that impacts the lives of so many women, takes them out of the job, takes them away from their kids. And we need as many tools as we can to help solve this problem. And the reason it's so hard for people to fix is that there's not just one thing going on. There are a dozen problems going on under the surface that are making multiple systems within the body function in this suboptimal way. And it all results in this final common pathway of migraine if you've got that wiring in your brain. And so I think people should just stay on it.
Makes sense. Absolutely. And then when it comes to your education process, I love the vision that you've set forward. I love how many patients you're able to help. Can you help us understand just your methodology with case management with patients? So I know you have some excellent online courses and resources for your patients. Do you do testing, have them tune into the course, and then make recommendations of supplements? How does that look from a case management perspective?
Yeah, we do start with testing. I think the first step is to reveal the cause of the headaches with labs and genetic testing if that's an option for the patient. And then I think we need to go back in and work on nutrition. That's really the first step. And we do that with food and supplements guided by the results of those labs. And then I think for so many people, we need to fix leaky gut. It is a huge source of inflammation. So many people have lived with GI symptoms for so long, they think it's normal and they don't even recognize their symptoms anymore. So it is a hugely underdiagnosed problem. And we know that there's a huge correlation statistically between people with migraine and people with conditions like irritable bowel syndrome. So we know those links are there. I think that needs to be fixed. And then we need to help them detox, uh, you know, pollutants, toxins in our environment. They target our mitochondria. And as we said, the brain needs an awful lot of energy to do its job. And so if those mitochondria are weakened because of environmental toxins, they're not going to be able to, maintain that cell gradient that they need to in a neuron. And people are going to get all sorts of problems, not just migraine. And then I think a fundamental issue for so many people who've been sick for a long time is to help them balance their adrenals, to get their nervous system back to where it belongs. And that's what I see as the niche for smart devices. We can get so much information about our bodies these days. And you can use that information to see that you're healing, oftentimes before you actually feel better. So that's incredibly motivating. It keeps people going. They're like, okay, my numbers are going the right direction. I know I'm going to get there. So that I think is the ideal way to approach this. And that's what I do with people in the Migraine Relief Code online course.
Wonderful. Thank you so much for sharing these great resources with us. And as we wrap up another great session today on the Virtual Neurology Summit, I'd like to acknowledge Dr. Barrett for her excellent work in neurology. And to all of our viewers, I'd like to acknowledge you. Thank you for your commitment to brain based correction and objective clinical results. I'm Dr. Krista, your host of the Virtual Neurology Summit. Be sure to check out the Postural Neurology program to get certified in brain based postural correction. Stay tuned, and we'll see you on the next Neuro Masterclass of the Virtual Neurology Summit.